Okay, the little red dot's on. She's doing welcome in. Hello, my name is Marie. I'm with Kiana. Both of us are experienced instructors with PPM. We've been here. I've been here for 17 years. Kiana's been here for 8 years. We're just going to give you some ideas of what to use for props when you're doing a first aid video. First off, when you're doing bleeding, I always use, try to center around who you're teaching. Get to know who your audience is. If it's people in a nursing home or teaching or CNAs or whatever, a nursing home versus construction workers, then you can think of ideas of a construction site versus somebody falling down steps. Okay, so first thing is bleeding. I always teach people. Oops, I just fell on the ground. If they put their hand through a glass door or whatever, what's the first thing you want to do? Of course, make the scene safe. Second thing I want to do is have her sit down. If she goes into shock and passes out, I'm 5'11", so if I fall from a 5'11" stance and hit my head on the floor, more than likely I'm going to cause myself a concussion. Whereas if I'm sitting down in a chair like Kiana is and she goes unconscious, her head's probably either going to drop, or if she falls out of the chair, I can kind of help her lower to the ground. First thing, again, have her sit down. Kiana, I'm an EMT, can I help you?
Yes.
You have to ask permission of can you touch them or help them. They have the absolute right to say no, but if she says yes, and I don't have gloves on, but say, we'll use the example, she put her arm through the glass door, she came in, okay? She's sitting down, I don't have gloves on, so Kiana, go ahead and put this on your arm for me until I can find a pair of gloves, okay? I don't necessarily want to come in contact with her bodily fluids without gloves on, so I'm going to have her apply pressure. Once I put gloves on, okay, I'm going to assess the situation. If it's still bleeding through, I'm going to have her put another one on, okay? She's going to also be my assistant. If it's still bleeding, then I want to take cling, okay? And I want to wrap her arm. As I'm doing that, if I twist the cling, it makes it tighter. And then you would wrap all the way up past the wound area, up to her elbow. If she is still bleeding, okay, at a last ditch attempt, you would also use a tourniquet. Now, while I'm talking to her, I'm constantly talking to her, okay, I want to find out if she's on any blood thinners, because she's going to bleed out a lot faster if she's on blood thinners versus not being on blood thinners or aspirin. So I open this up, slide her arm through. I don't want to go over her elbow or her knee, okay? So I crank this down, and I tell her, hey, it's going to hurt, because it's going to hurt. I cinch this down real tight. I'm not going to do it because I don't want her to scream, okay? And I don't want to stop the blood flow to her arm. And then I take the windlass, and I start cranking down. Now you can have your students do this, because when you crank down, she can feel the tightness. Once you lock it in, or once it's tight, you lock it in, and then put that little tab over it. I always tell people, if she's bleeding like a stuffed pig, that little tab that says time on it is probably going to be blood covered. So take a magic marker or something and write TK, whatever time it is, 139 across her forehead. That way, if there's multiple people that have injuries and they all go to the hospital, the ER staff knows that she has a tourniquet on somewhere on her body. Now, if you don't have a Sharpie or whatever, you got to use what you can, or whatever, you know, think outside the box. If push comes to shove, you have rubber gloves on, dip in her blood, and write TK 139 across her forehead. That way, the staff knows that she has a tourniquet. Now, if you don't have a ready-made tourniquet, but you have a cravat, okay, Fold the cravat. You don't want to make it too skinny, but make it about 2 or 3 inches wide. Okay. If the cut's here, again, I want to go above. Okay. Come around, tie off, and use whatever's available. If you have a wooden spoon in the kitchen, or if it's in a body shop or a mechanical shop, a screwdriver, or if all else fails, use a pen. What happened to the pen?
Oh, we have several, I thought.
Or a pencil. Okay, stick this underneath, and then just crank this again. She's gonna feel it getting tight, and then once I've cranked it, okay, tie it off so that it stays in that position. If you let it go, it's gonna spin and it's gonna release all the blood flow back down to the extremity. Okay, so tie it off again. Put TK somehow on her forehead, so that the hospital staff knows and other people know that, especially if it's a mass casualty incident, that she has a tourniquet somewhere on her body. The EpiPen, where are the EpiPens? Okay, I usually demonstrate 2 different types of EpiPens. This one, have them hold it like this versus like this, because they don't administer EpiPens that often. If they put it on the wrong end and they hit it, it's possible that the needle could eject out and into the caregiver's thumb. I always tell the person, feel on the patient of where you're going to give it, just in case she has a wallet or a cell phone or something in her pocket. I want to make sure it goes into her skin. Okay, I put my knee on the inside of her knee because she knows she's getting a needle, and her tendency will be to pull away from me. So if my knee is against her knee, I inject it, pull off the blue tip, count to 10, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and then pull it out. If you don't have gloves on, a lot of times it will bleed just like any type of needle that you get. Have the patient rub their leg, for a little bit to get it moving into the body. Okay. There's also the talking EpiPen.
Contains no needle or drug. To inject, place black end against outer thigh, then press firmly and hold in place for 5 seconds.
Okay, same thing as the other one. I want to position my knee.
Inject, place black end at 5, 4, 3, 2, 1. Injection complete.
And
This trainer may be reused for training.
you can have them practice on each other or themselves, of injecting themselves. Okay? I always teach them that they have to ask permission. Hey, is this your EpiPen? Make sure it's the patient's EpiPen before you administer. Also look at the expiration date. If it's expired, you want to look at it, see if it's clear. If it's starting to crystallize, it's no good. If it's expired, technically you can't give it to them. But there's a way around that. Pull it out. Kiana, do you know that this is expired 2 months ago? Here's your EpiPen. If you want to inject it, go ahead and inject it in yourself. I can't inject it, but she can do it to herself. Okay? What else are we doing? Inhaler, same thing. I am not going to have her inhale in this because then you have to clean it off, but at least pass this around so everybody gets familiar with it. Again, have them shake it, look at the expiration date, make sure, hey, is this your inhaler? Okay, if it's an inhaler, have them bite down on the hard part and wrap their lips around it. Okay, and explain to them, look, I'm going to push this button or push the medication when you breathe in. People with asthma, they can breathe in, they just can't get the air out. So as they breathe in, you push the button, it puts air in, or the medication in. Have them hold their breath for 5 to 10 seconds, okay? Some people use an inhaler, okay? Small kids, and a lot of older folks use an inhaler. The kids like to see the medication come through the tube. This is easier to put your teeth and your mouth and your lips on than this little thing, okay? Blood sugar, if diabetes is very common, again, for every scenario, I have the person sit down. You have to ask permission, hey, can you help them? If Kiana's blood sugar is dropping, I can offer her orange juice, any type of juice that has sugar in it, maybe a soda. Sodas don't work as well as natural juices. If they get to the point that they're kind of in and out, or you can give them glucose tablets. A lot of diabetics carry glucose tablets, or the glucose paste, okay? If she's able to chew, give her the tablets, give her Skittles. Skittles has a high concentration of sugar. If she's getting kind of woozy on me, like she's ready to pass out, you can take the glucose paste, twist off the top, pull out her lip, and put it between her cheek and gum, okay? That way her body absorbs it faster than if she's swallowing it. If you don't have this, I always carry cake frosting. Try not to get the red, because the red, a lot of kids have allergies to the red, so I don't try not to use red, but the same theory. Put it in between their cheek and their gum so that the mucous membranes will absorb it. Impaled object, if she's got an impaled, and I demonstrate this, but if she's got an impaled object into her stomach or whatever, I want to stop the bleeding, and I want to go, okay, go this way, and then where's the rest? Okay, and then alternate. Just remember, if you can wiggle this on the outside, you can move it on the inside, okay? Instinct is to pull it out. If it's impaled, leave it in there, okay? It may be up against an artery or a vein. If you pull it out, it'll be bleeding internally, okay? So leave it in there, bring it all the way out. I would bring it out as far as you can. Again, if you can wiggle it on the outside, you can. It's going to be wiggling on the inside, and you're going to do damage to the inside. After you get it built up, go ahead and take cling and go all the way around her body, okay? Have your students demonstrate this, or you can demonstrate it on a student if you don't have a mannequin or whatever available. Same thing with a hand injury. I just build it up. I usually use a pen and just stick it between my fingers and alternate which way the pads are going, okay? With an eye injury, I always use the old nail in the eye. Ashley videos actually show a nail in the eye. If she's got an eye injury, again, I'm going to pad the area, okay? Slide this over, oops. Slide this over her eye so it pads the area, okay? And then I want to put a cup, okay? If it's a long pencil or a long piece of something, cut a hole in this, would put this over her eye to help stabilize it, okay? And then I take cling and wrap all the way around her head, okay? Also explain to the students that, hey, you have to stay with this person. When you're wrapping, you also want to cover the other eye, because our eyes move in the same direction. So if she's looking that way, her right eye, her good eye as well as the bad eye, is going to move. Also, if it's a pupil injury, if she goes outside like this, her pupil will either constrict, and it'll hurt the pupil of the right eye. Stay with the person, don't leave them, because you're now taking sight away from a seeing person, either say, Kiana, I'm here with you. I'm going to stay with you until EMS arrives. Hey, is there anybody that I can call for you? I never tell somebody they're going to be okay. My level of okay might be different than Kiana's level of okay. Be creative in what you do. Always have a backup plan. An instructor's worst nightmare is you get to a location and they don't have everything that they're supposed to have, or they lied and said, oh, we have a projector, but the projector isn't adaptable with what you're using. So, or if the video dies, for some reason you're showing it off your computer and all of a sudden the computer dies. Have a list of everything that you need to cover in order to certify this person in CPR, or not CPR, but in first aid. Packing a wound. Kiana has the idea of a yoga block. Say this is a person's leg and they're bleeding terribly, okay? What part of a shirt are you going to use to stuff in it? Have them stuff the wound, okay? You can stuff it with a shirt. If you have gauze, you can stuff gauze in there and then hold pressure on it. Have the student actually do that, okay? Because in real life, unfortunately, things are getting to that point with all the mass casualty incidents that we're having. People need to learn first aid, okay? So stuff the wound, even if it calls for taking a roll of cling and stuffing it in there, and then putting direct pressure on it, okay? Just because you pack the wound, it's probably still going to bleed. Cover it up with something and put direct pressure on it to stop the bleed. Anything else you can add?
Just focus on your props. So different props that you can use, because it's all about thinking outside of the box. We don't always have cling. So what could you use to control bleeding in other situations? So you want to have your different props. This is a baby's pamper. This is wonderful for absorbing blood, as well as the good old Kotex. This is wonderful for absorbing blood. As well as have your props for your amputations. This is an amputated finger. You can make jokes and say, oh, accidentally tell a story and this person lost their finger, and now you have to manage the bleeding, as well as what do you do with this finger once everything else is under control. And we will put it on ice. The video shows this. So as a prop, you can have your fake ice. This is stuff that you can get from anywhere, even a dollar store, as well as talking about if I don't have gloves. Again, improvise. I can put bags on my hands or use their clothing. So you do have to also incorporate in your training how to think outside of the box, because we don't always have that elaborate first aid kit available. If a person goes into shock, what could you cover them up with if you don't have a coat or blanket or things of that nature? We talk about newspaper can cover a person that's a victim of shock. You cover them up with that, as well as get your bag. This can also, for instance, if I have my intestines protruding out of my body, and we know we don't push those intestines back in, but we do have to cover those intestines with a sterile moist dressing. I don't have a sterile moist dressing or anything to moisturize available. Plastic can go directly over this injury. So this is what we mean, have your props. And these things can be folded up and put away easily. You should now, which will be required for your first aid class for PPM, you should have a real cat tourniquet in your arsenal to train with. Let your students hold it and touch it. So this is what we're trying to drive home, where we have certain things that you would use. I'm going to turn it back over to Marie. We're going to go into splinting and what items you can use in that situation.
Okay, now if it's say Kiana twisted her ankle and she's at home, okay, everybody doesn't have a ready-made splint. You could use a pillow, ask your students, hey, what would you use if, you twisted your ankle at home? You could use a pillow and wrap first aid tape. A lot of people don't have first aid tape. Rely on duct tape, or any type of tape that you have, masking tape. That'll work. Just wrap it around. Just make sure that it's not real tight. Okay? If she fell, one of the scenarios that I use for 3 or 4 of the sections on the video, the AHA video, is a guy's changing a light bulb, he's on a ladder, you come around the corner and he's on the ground. I tie them all together. What's the first thing you want to do is say, don't move. Because as soon as he or she hears your voice, they're going to turn their head. Don't move, I'm coming to you. Okay? Hey, how are you doing? If they don't remember what happened, it's a good chance that they hit their head and they could have a concussion. Okay? Ask them, hey, did you hit anything on the way down? Okay? Then you have your internal bleeding. You don't always see internal bleeding, but hey, while he came, was he up high when he fell, or was he on the first step when he fell? Did you hit anything? He came down, I always use the example, he came down and hit his forearm on the table, and it's kind of not right. So what would I want to do? Would I want to split him like this, where his hand's off the end of the board, or would I want to split him like this, where his hand's on the board? So I'm going to split Kiana. Okay, I can either take cling and go wrap her arm all the way to her elbow, okay? Or if you don't have cling, if you have your handy dandy cravat, okay, fold this up, tie one here, and you're not trying to stop the bleed, so tie the knot on the hard part of the board, or a magazine, or whatever, clipboard, or whatever you have available. Okay, you're not trying to stop the bleed. If the injury's here, I want to go above the injury and tie another cravat here. Again, leave the injury open, or if you're going to cling it, just make sure that you don't put a lot of pressure on the cling. Then, I'll pass it this way. This is a test. Do I have enough cravats? Yes. Okay, if I want to make a sling, I then take another cravat, and I demonstrate this in the classroom. I find the short end, I tie a knot in it, I come in between the patient's arm and the body, and I slide this up this way, okay? Put her elbow in the pocket, and then bring this up, and I always pad where I'm going to tie in the back, okay? If that's not good enough and they still want to move it, then you take another cravat and you go across the bad arm and underneath the good arm, okay? And then tie in the back. Just remember to pad the area where you're tying the knot, okay? If it's a large person, you might need 2 or 3 cravats, because I think the newer ones are a lot smaller than these, okay? Anything else?
Oh, sounds good to me.
Can you walk to the ambulance?
Yeah, I can walk. So the moral of this is think outside of the box. If you don't have cling available, if you don't have a cravat bandage available, you can use neckties, you can use neck scarves. This could have been a tank top. So you want to make sure you fuel your students with as much information as possible in reference to thinking outside of the box if that elaborate first aid kit isn't available. We thank you. This was just an introduction of some of the things that you can do in your class to incorporate student activity and hands-on skills. Have your students demonstrate the epi. Have your students practice wrapping each other. If we have a climate where some people still don't feel comfortable with being touched, you can get objects like your fake body parts to be the demonstrator. Be something that they can demonstrate on. So be creative and have fun. I thank you for watching this video with Marie and I, and we wish you the best of luck in your teaching.
And if you have any questions, feel free to call Kiana. She's here most of the time, in and out. But have a great day and good luck.